Hi everyone, it's Dr. Ansari. Now I'm going to be talking to you about overactive bladder, which is the urinary frequency, urgency, and leaking before you get there. We're going to be talking about medications. Okay. Now, if you're a patient of mine and we've talked about medications, and based off of your individual situation, I may have already recommended certain medications and maybe recommended that you do not do other medications. So just remember that this is general information and it does not negate anything that we talked about in the office based off of your individual health issue or family history. Okay, so overall, general information about overactive bladder medications. These are to help decrease the frequency at which you go and the leaking before you get there. So to help to get you to the bathroom to empty your bladder on time before it leaks. So the first medication that we have is called anticholinergic. Anticholinergics are very old medications, and we can actually classify these in two basic categories. One is the set of medications or anticholinergics that enter the brain, and another set that do not enter brain. Now, in our practice, we only prescribe the ones that do not enter the brain. Now, well, I should correct myself and say sometimes we do prescribe the ones that enter the brain, but it's under specific circumstances. We really try to stick to the three medications that do not enter the brain. And these three are darafenacin, also called Enablex, okay? Darafenacin. The other is trospium and fesoterodine. Trade names: Enablex, Sanctura, Tobias. All right. So the reason why we try to focus on just prescribing these three medications is because this entire family of drug, the anticholinergic family of drug, has been associated with potentially the development of dementia with long-term use. So that's why we want to avoid this medication, the type that enters the brain, because we think that the ones that do not enter the brain are safer. We actually don't have the data right now to actually prove that they are safer. Those studies are probably being conducted as we speak, but we don't have that data yet. We just think that theoretically they're going to be safer. And the reason why we even prescribe any of these anticholinergic medications is, as you will learn as we go forward, that the treatments for overactive bladder are limited. And so we really don't want to reduce the number of treatments that we already have if it's possible that it's going to be safe in a segment of people. So we try to just stick to these three medications, but sometimes we do have to prescribe other medications that do enter the brain, but that's under very specific situations. We really try to avoid that. Now, there are some folks that are not eligible to receive anticholinergics, and so those are called contraindications, okay? These are reasons that one cannot be prescribed this medication. Number one would be, I would say, a strong family history of dementia. Okay, dementia is likely gonna disqualify you from getting these anticholinergic medications. Number two, if you have a gastric emptying delay. Okay. So this is if your doctor, your gastroenterologist, your GI doctor has told you that your stomach does not digest food very well, then that means you have a gastric emptying delay. And then also if you have narrow angle glaucoma. Okay, those are reasons. These are specific medical problems or histories in your family that would disqualify you from getting the medication. Next, let's talk side effect of this medication. Are dryness, like dry eyes and dry mouth, and constipation. Okay. So if you have dryness or constipation and the medication is working, we might actually choose to treat the side effect rather than discontinue the medicine. So we might actually start you on stool softeners or eye drops or Biotine mouth rinse for the dry mouth, to try to help with the side effect if the medicine is working for you. Now, a no-go is confusion. If you have confusion as a side effect, you need to stop the medication. All right. Now, there's another family of medication that that we have here. Let me just bring this overactive bladder, and we're talking about medications. Okay, we already talked about the anticholinergics. There's another family called Mirabecron. It's not Mirabecron. It is not an anticholinergic, and it does not enter the brain. So overall, that increases our number of medications that we think are safe to 4, the 3 on this side and then this one, Mirabecron. The trade name for Mirabecron is Mirabecron. So Mirabecron is a medication that works in a slightly different way than an anticholinergic, but the whole point is the same. You want to decrease the frequency at which you go and get you to the bathroom on time before you leak, so you decrease the number of leaks. There are a few reasons why we may not be able to prescribe Mirabecron. You may not be able to use Mirabecron if you are on many or like more than 2 medications for high blood pressure. Okay, and the reason is because Mirabecron can cause a side effect of high blood pressure. If you have high blood pressure and it's controlled with diet or maybe one medication, then maybe we might be able to prescribe Mirabecron and just monitor your blood pressure, and if it goes up, we stop it. So that is a possibility if you wanted to try it. The other reason that I may not prescribe Mirabecron is if you have a history of migraines, because chronic migraines, because it has a side effect of causing headaches. So just keep that in mind, and let me know if we haven't already discussed that. And also, it does have a unique side effect of causing pain or swelling of the nose and throat. Okay, so if you have that, then we need to stop the medication. Both of these medications here, the cholinergics and Mirabecron, can cause issues urinating. Sometimes they work too well in helping the bladder to the point where you may not be able to urinate at all. So if you notice you're having difficulty emptying your bladder, then that's a reason to notify my office right away, and we would need to stop the medicine right away because of that. Right, I hope that this helps. I hope this talk helps with clearing up some issues related to the medications. And if you have any questions, then please just call the office. Thanks.